Hi, I'm Dr. Dennis Wong. Thanks for joining me today as I talk about all things dementia. For those who have been following me previously, thank you very much for your confidence in me and your interest in this topic. For friends who are here for the first time, welcome. But can I please encourage you to go back to the previous two series, as these are written systematically and like to tell a story. This can be found on our website www.primegardensrs.com.au. Today we're going to talk about the last subtype of Alzheimer's disease, which is the most controversial type of Alzheimer's disease. There is evidence for, but there are also evidence against and indifference. And this subtype is called chronic traumatic encephalopathy, or CTE in short. So what we thought is this. The prefrontal cortex of the brain is most susceptible to blunt trauma. This part of the brain is our forehead, and it's tasked with decision-making, social behavior, judgment, executive function, and planning and abstract thinking. As you know, it is a very, very important part of our brain. So apart from avoiding the slightest trauma, the potential solutions are not dissimilar to those subtypes, except for an exceptional type of exercise program which uses oxygen therapy while we are on the bike and exercising. Because numerous studies have shown that oxygen therapy could improve the risk factor and clinical symptoms of Alzheimer's disease. Increasing evidence also suggests that oxygen therapy may improve many pathological features of Alzheimer's disease, including a beta metabolism, which is the AHA molecule discovered in 1984, tau phosphorylation, decreased neuroinflammation, increase in neuronal apoptosis. Apoptosis is a concept where cells regenerate itself, given the situation or environment it is in. Oxidative stress, neurotrophic factors, mitochondria, which is the powerhouse of individual cells function, cerebral blood volume, and protein synthesis. Friends, as I mentioned before, this is a controversial topic. Some evidence suggests retired professional footballers have unequivocally lower cognition than their counterparts. However, there are also evidence to suggest that cognitive deficit is only temporary while they were playing professional football, and these are potentially reversible once a footballer retires. So the jury is still out, in other words. Friends, sharing what I have learned for the past 6 months has been a pleasure with all of you. I felt like I owe that to you if I don't share and hold this potentially the most significant breakthrough in dementia. And by the way, Alzheimer's disease is the most common type of dementia. There is hope of having to live happily ever after with your loved one without having to face dementia. This series now completed. In the next series, I'll begin to unpack the genetic aspect of Alzheimer's and its potential impact on management. Until then, live well, live with passion. Don't let tomorrow's worry rob you of today's joy. Have a good day.